What kind of tips from your experience now, since you've done the ACJ, and of course, before the results come out, you're always like in this mode of, I don't know if I did enough. I don't know if I passed. And then when you pass, you're like, hey, I did it. What would be some tips to give people for the ACJ preparation?
To trust the process, to not over answer, to make sure you're staying focused during exam or practice cases or mocks, and just power through. If you're in pain or if anything happens, just power through. Like you can do it.
And do you think like 3 months is enough for, let's say, majority of people, or some, because we do notice obviously some people need more time sometimes, but do you think 3 months? Did you study first of all for 3 months straight, or did you enter late?
I feel like because I've always been in contact with AFK, so I've always been studying since I finished the exam. I don't feel like I only studied for 3 months, so I feel like I did get a little bit extra, because I just kept studying. So it might not be enough for everyone, but in general, I feel like it's a simpler exam than the AFK, so it can be enough. Like 3 months can be enough. It's a more relaxed exam. It's fun. It's
fun to study.
It's fun to study. Yeah. It's fun to take the exam. Like I always say that I sound like such a nerd. I love taking tests, and this was like one of the funnest ones, despite of the pain. I swear. It's just like fun. It's like different. Really.
I agree. Like looking at cases and trying to solve them, it gives you like this. And also, you were saying like, I forgot where I wanted to go with that, but but no problem.
Good.
It's okay.
Yeah, it just happens. ADHD. but so I'll say something. After AFK, because like it's just like text, this feels like, oh wow, like breath of fresh air, like some images, something, like something different.
It's like from practice. You're practicing. You actually feel like you're practicing. Oh, I think, so what I wanted to say was like, it depends on where you start also with your judgment level.
Yeah.
Because sometimes it's like you're trying to correct these habits, right? And then some people could adapt to new habits faster than others. So it's like, can you prevent yourself from over answering? And I find that some, even though we're telling them that, we're instructing them, they still keep doing it over time. And it's like, how do you kick this habit out of you of trying to perfect the answers or something?
I was so worried about this because when I started the ACJ course, we got a practice. Was it 1 or 2?
I think I start you with an introduction case, just before you learn anything, just to see what you would do.
Let's see what you would do, like how you would do. And I was very confident with my knowledge, but I ended up like embarrassing myself a little bit live. Again, the boss made me do it. I'm just kidding. No, I volunteered myself to do it because I thought I was just confident, right?
It's good learning. You learned from it, probably.
It was great. Look, I love embarrassing myself. Let me explain. Like, that's when I learned best, like, because you embarrass yourself for like, oh, wow, like I need to analyze myself. Like, what did I do here wrong? And I did score like 55%. So I was like, oh, wow, like
55,
55.
Yeah. So instead of saying maybe like you like to participate and take the risk.
I do.
Which is good. It's good to participate.
Yeah, in other words, I do like to participate and
take the risk, and you might be wrong, right? And embarrass yourself. But and you learn from that. Like I think one of the things that people go through in the beginning is like they answer based on why not.
Yeah.
And just answer a lot versus like, no, this is a treatment for this, so you pick it. But don't pick just why not things like, oh, why not this and why not that? Yeah. Because some of the options are actually a negative one and you lose the question, right? Yeah. That's the thing where you want to fix. When you have 15 options, it's hard for people to go, oh, there's only 1 or 2, and they want to answer like 7.
Yeah. And then also, I was like so confused with the templates. Like there are the templates, and I remember in one live session I looked at a picture. I was like, what do you guys think this is? I was like, oral submucous fibrosis. It's not even in the template, I was like, no, but this looks like it. And Dr. Rabnik, I think she was like, we have to stick to the template, so I was so confused, but thankfully I was able to learn and rewire, and my brain oh, this is a different exam.
Yeah, you're trying to like, well, it's good to try both. Like we stick to the template where you master it, but and then you never know, they could bring things out of the template.
They could, yeah.
And then they bring you that option if they want to. And then it's kind of like a clue a little bit that if they bring you a new option, it might be it.
Yeah.
But yeah, it's good that you're remembering Legion from AFK and you're trying to